this is called AED. So if you arrive on the scene and you've got another person with you, you're going to tell that person, hey, I've got an unconscious, unresponsive person here, not breathing, don't have a pulse. I need you to go grab the AED and call 911. If you arrive on the scene, it's just you can go grab the AED real quick if it's within, a close distance. If it's not close distance, then you're just going to wait for somebody else to pass by, and then you'll tell them to go grab the AED. You can start the CPR, but what you'll do at that point is flip open your phone, put it distance away, hit 911, and then start CPR. But for the purposes of today, I'm going to have the AED close by so we can demonstrate how to use it. I'm still going to want to flip open my phone and put it a distance away so that it doesn't interfere with the AED's ability to read. I'm going to hit 911. I'm going to call, have them on the phone while I'm doing CPR and using the AED. If the person is, let's see here. Once you have the AED, you're going to want to turn it on. This is an iPad. I don't have an actual AED, but it's going to look something like this. It's going to have a little button in the center, orange button maybe. And then you turn it on, it's going to tell you exactly what to do. First thing it's going to tell you, you're going to set it beside you on your side here. You don't want to be reaching across the patient or the victim. You want to have it on your side so you don't accidentally touch them when it's shocking them. It's going to tell you exactly what to do. So the first thing it's going to say is remove the clothing from the person's chest because you want to have a place to put the pads, obviously. On a male, all that's going to take is just removing the shirt. You'll want to wipe them down if they're wet. The kid will have a razor in there. You can shave the upper right and bottom left area where the pads are going to go because you don't want any hair in the way. On a woman, that's going to take removing the shirt, swimsuit, bra, tank top, anything that they have on. Underwire bras especially will interfere with the AED's ability to analyze. You're also going to want to remove any jewelry, necklaces, nipple rings, anything that they may have, completely bare. Again, like I said, you'll wipe them down with a towel, make sure they're not wet, and then shave the area. Also, if you can't remove it easily, the kit will have shears in there. You can just cut the clothing up to center. Let's see, then you want to wipe them down, shave it. Okay, so the pads will go, like I said, on the upper right and bottom left. It'll go right between the collarbone, the upper right, it'll go between the collarbone and the nipple. So again, you're going to have them bare chested, so you're going to be able to see. That's where the pad will go, and the other one will go on the lower left below the nipple. And the diagram on the pads will show exactly where to put them. So once you get all that done, it'll say, the AED should tell you attach the pads to the person's chest as shown. Again, the pads you're going to get are going to have a diagram on them, and it's going to show exactly where to put them. I don't have that. I have little 10 unit pads I'm going to demonstrate with. So I'm going to do that. It says attach the pads to the person's chest. So I'm going to attach here, like I said, between the collarbone and the nipple. This is not attached to a 10 unit, so there's no chance of her getting shocked here. And then lower left, below the nipple, it'll probably be right about there. If you're using, this is for adult pads, and sometimes it'll be just one whole kit, and it'll have a little cross arrow that'll be in the center of the chest where you'll be doing CPR. Sometimes it's just pads, but it'll tell you, the kit will, or the AED will let you know if they're in the right place. The adult pads, like I said, they'll go here. Pediatric pads, if you're working on a child, the pediatric pads, if you have them, will go center of the chest, and then the other one will go on the center of the back, and you gotta make sure they're not touching. If you don't have pediatric pads, you can use adult pads. You'll just, if it's one big kit, one will go here and the other one will wrap around and again go in the center of the back. So you can use adult pads on children if you absolutely have to. Then the AED should say plug in the connectors. So I'm going to take like this, just plug in like that, right? And then the AED will tell you stand clear, analyzing heart rhythm. So at that point, you're going to want to tell everybody stand clear, because you don't want anybody near. If you touch them, it's not going to analyze correctly. So stand clear so that the AED can analyze. AED is going to analyze, so it's either going to tell you stand clear, shock advised, or no shock advised, check for signs of life and begin CPR. If the shock is advised, verbally tell everyone stand clear, then the AED will tell you press the shock button. You're going to take it, or it'll say press the shock button or the orange button. And you're going to want to take it and click that orange button right in the middle, right? The AED will then say shock delivered, check for signs of life and begin CPR. After the AED tells you to check for signs of life and begin CPR, you're going to go in, you're going to check for a pulse, just like you would on the carotid artery here, boom. You're going to look, listen, and feel for breathing across the chest. And then if there's no pulse, victim's not breathing, unconscious, and there's no signs of life, you're going to be in CPR. So like we did in the last video, begin CPR. Until the AED tells you to stop again so it can analyze, because it'll stop you again. Some AEDs will even keep a rhythm for you. It'll go, and it'll tell you to go speed up or slow down. It'll tell you to go deeper if you're not going deep enough. Some AEDs will do that. Basically just letting you know whether or not you're doing CPR the correct way. If there is a pulse, if you get to a point where there is a pulse and the victim is breathing and CPR is not required anymore, there are signs of life. You're going to roll the victim into the rescue position like this, and you're going to monitor for, you're going to continue to monitor his or her condition. Again, this is called AED, and this is how you would administer the AED or use the AED on a patient.